I know you're working at the COVID-19 unit. Has that impacted your day-to-day life?
Oh, goodness. Absolutely. I feel like I'm living through sort of almost someone else's life. And the person I was 6 months ago is somewhere else. It was a completely different time in many ways. So
Mhm.
I think this
What's
virus
your Yeah, I think that's a lot of us too, with including our viewers.
oh
No
yeah,
one knew
I think
that
virtually
2020.
everyone in the world.
Yeah,
Yeah.
everyone in the world. Yeah, I know you have family in Spain. I have family in Hong Kong. I have some family in the UK. So yeah, everyone. Yeah. What's your understanding of COVID-19? You are working in the front lines, so I'm sure
Yeah.
you have a really good understanding of it.
Yeah. Ah, well, I should understand probably more than I should understand more than I do. What I understand about this pandemic, this disease, is I think more of the practical aspect of it, more than maybe the specifics of it or the technicalities of it. It is an infectious virus, more so than the typical flu. The particular aspect that is alarming about this virus is that I've been reading, for example, that it gives mild to moderate respiratory symptoms, and I see that working in the hospital. But what is significant about this particular virus is that those that have underlying conditions, whether they be respiratory, COPD, those that were previously smokers, those patients that were previously smokers, if you have any type of underlying condition, the virus is particularly aggressive. And so people that maintain a baseline good health have much less to fear than someone who has less than ideal health, and they contract corona. So what I see is a pretty aggressive virus, especially if you have underlying conditions. That's what I see. And the more on in society, I see that this is when I hear the coronavirus associated to being a pandemic or defined as a pandemic, I see it that it affects, everyone, like we were saying, pretty much everyone in the world, and in the hospital particularly. It has sort of everything in the hospital revolves around this coronavirus outbreak. The scheduling, the hiring of personnel, of staff, how we dress in the hospital has changed. We can't share food anymore among coworkers, for example. There are certain functions in the hospital that have been modified, like there are many less surgeries. Everything revolves around the coronavirus. So that's the way I live it. I would also say that it doesn't necessarily it doesn't spare anyone, really, because it's so easily spread. It has penetrated all levels of society. And of course, I may or may not know the patients from previously in the hospital. I've worked in the hospital several months, so some of the patients, unfortunately, I've seen before. But there are also patients that that are young and that are healthy before, and the coronavirus has got them too. So this is not just a flu that you can get a flu shot and that's it. This is much more complex. So
yeah, it doesn't discriminate age, gender,
No,
background,
no,
anything? Yeah,
absolutely not.
yeah.
Absolutely not.
So you're saying really right now your life is revolved around COVID-19
Yeah,
because the
yeah.
hospital is, yeah. What's your
It,
day-to-day life like now at the hospital?
right. It affects life inside and outside the hospital. Now, as far as in the hospital, we have our schedule. We're given our schedule.
Mm-hmm.
We go in, and if we do not have to be at the hospital, we're discouraged to go. I don't know why we would go anyways, but um, in the entrance, before it was just a free entrance, there's a hall that you would walk into. Now there is a check-in station where you take a survey. They ask you if you've had any type of symptoms in the past 24 hours, and
Oh,
once
you
you
do that
pass that,
every day?
every shift, absolutely every shift, you
Wow.
have to do it within 2 hours of going into work. And if you pass the survey, so if you pass, you get this green check mark on your phone, on the screen on your phone. And if you pass, then you go to the next station, which is the hand sanitizer station. So you put some hand sanitizer on, and then we put a mask on, and we are required to wear the mask all through the hospital. And that's unit 2. There are no visitors anymore in the hospital unless the person is close to death. You know, they make an exception for that, but there's no family, no friends, no visitors. So it's almost eerie. The hospital has turned into a different place, really. People don't commune there anymore. It's very different. Then because I work on the COVID unit, we go to a locker room that's designated to the COVID unit, and there we change into scrubs that are dark blue. We're all dressed the same. Those of us that work in the COVID unit, we're all dressed the same. We're not allowed to wear our regular clothes. And then when we leave, we take we change back into our normal clothes and go through that same hall again. And right at the door before we exit into the parking lot, then we can take our masks off. So that feels great because I feel like we can breathe again.
Yeah.
Yeah, and lots of hand sanitizer everywhere.
Yeah. Now, is there a shortage when it comes to mask and hand sanitizer?
There is a shortage. That's correct. The hospital has put in place some protocols to make sure that we don't use the material excessively, that we don't waste any material, because the doctors and the nurses and the respiratory therapists, when they go into a room, they have to dress in a special gown and gloves and a mask and a special a special mask and some goggles or a face shield. And there's a shortage of all of that, actually.
Yeah.
So there is a shortage. I have not witnessed a moment where they have gone into a room without any of that. So the shortage is not so bad that it's absolutely unavailable, but
Yeah.
there's a shortage. Yeah.
Yeah. And you're going right back to that in a few hours.
Yep, that's correct. Yeah.
Yeah. Now, Jose, did you sign up for this, or were you asked to join the COVID-19 unit?
Well, I was given the option because as a physical therapist, there are not enough patients for all the physical therapists on staff. And so I was asked if I would be willing to work on the COVID unit. But I have to be honest, it was a very easy decision, because if I had said no, I wouldn't have hours. So
yeah, that makes sense. Yeah, because I heard some nurses are being laid off, and PTs too, because they're
absolutely. And that's a very difficult topic. I have learned to be humble and just go to work when I am giving shifts. If I'm given a shift through the night, I go anyways, because there are so many people that don't have jobs.
Wow.
And so I'm thankful to the health system for which I work for, and my superiors for giving me hours to work, because I know people that have gotten laid off and they don't know what their immediate future looks like. So
Wow.
yeah.
And are the friends that you know, the coworkers you know who have lost their jobs, are most of them in Michigan or in other states?
all over,
Yeah.
unfortunately.
Yeah.
It has affected some sectors of the healthcare system more than others. I work in a hospital, and a hospital will never shut down, right? So
Hmm.
I'm safer, so to speak, than other therapists, for example, that work in outpatients. So they work in a clinic. They are much more at risk than myself. So, but absolutely, and I know people in other countries too that either they have gone furloughed or laid off, or have
Yeah.
uh, less hours to work,
Yeah.
significantly less hours to work. That's here in Michigan, Illinois, Indiana, California,
Yeah.
Europe, everywhere. Yeah,
Yeah.
everywhere.
Yeah. And you have a lot of families in Spain and probably other friends in other European countries too. So not just physically demanding, but emotionally too, right now for a lot
Right,
of medical providers.
and this is the aspect that um, I don't. I hope I'm not a pessimist, but everyone talks about we're expecting a peak in coronavirus cases, and after the peak, everyone seems to be more optimistic. I think that this pandemic has affected society so much that I'm fearing what's going to come after we peak, when we start going out into the streets again. I think that depression, anxiety are on the rise. We just don't see it yet.
Yeah.
I'm not necessarily more fearful of that, but I just think it's a very serious thing we're going to have to deal with.
Yeah.
So physically, it affects. It's affecting some of us more. Just getting used to the different shifts and the 12 hours, and that it's certainly physically affecting patients, of course.
Hmm.
But emotionally and psychologically, it's taking its toll. Absolutely.
Yeah. Would you say that's a bigger challenge when it comes to
Me?
like finances and job security? That would be a
Yes,
bigger challenge than physical. Yeah.
I do.
Yeah.
I do.
Yeah. Now, Jose, have you talked with some other friends or family members who are also medical providers?
Yeah, I have. Um, I've talked to several people. There are people suffering from in different conditions, right? Some are higher up in the but maybe they're more advanced in their professions, and so they have more job security. Others have less job security. I I lived in Loma Linda, California, which is a big medical community. So I have all types of friends that work in different areas of healthcare, and all types of difficulties. So some are doing better than others. Unfortunately, I do have friends that are not doing well at all, and it's
Yeah.
difficult. Yeah.
What would you say the biggest challenge right now for you or from your friends that you have talked with, the biggest challenge because of COVID-19?
The biggest challenge. I think the biggest challenge is, I would say two. One is there are people and families that were previously living paycheck to paycheck that now cannot live paycheck to paycheck just because the paycheck isn't there.
Yeah.
Um, and so that's I think that's a huge challenge. I know it
Yeah.
doesn't affect everyone, Like I said, thankfully, I myself am not affected that way. But I think that's the most extreme case, apart from obviously the those that do pass away from the coronavirus, which is
Right.
terrible.
Right.
But outside of that, it would be the people that cannot make it to the end of the month, or to
Right.
the end of the pay period. That's terrible. And we're talking about people that don't live luxuriously. It's not that they cannot pay their bills because they can't afford the monthly payment on their yacht or things like
Mhm.
that. It's those people that can't provide for their families. That's very difficult.
Yeah.
That would be the first thing. And the second thing is what I mentioned. I think that the mental health aspect is it's a hidden factor, I think, still,
Mhm.
but it'll
Yeah.
surface. It will.
Yeah. Yeah. And for the medical providers too, right? Because most medical providers go into the position, their career, thinking that I'll never lose my job. There is job security for all
Right.
nurses, doctors,
Right.
physical therapists. So this
Yeah.
is all very shocking.
Yeah.
So for sure, emotionally, it's going to take some work for the whole community to work
Yeah.
together to support our medical providers.
Like I mentioned, I'm fortunate to work for a hospital, and so in a hospital that really is the front line.
Hmm.
And the hospital is always open. It will never shut down. Uh, on the contrary, it seems like it's in a sense more open now, just
Hmm.
because we need hospitals the most. But that's just one sector of healthcare. There are outpatient clinics that have completely shut down for a while, and that affects its employees.
Yeah.
Um, in the area of psychology, they are able to do virtual meetings through the
Hmm.
internet, and that helps as well. But you really can't do physical therapy the same way, and that's affecting a lot.
Yeah. Is there anything that the community can do to help support our medical providers, like you or your friends?
Um, I That's a great question.
Other than the care packages.
Yeah, that's a great idea. Well, there's obviously not one thing. Um, so
Mhm.
that's a good question. That's another thing I should know more about. I have been really encouraged by seeing how different uh, businesses, both big and small, both local and chain businesses, have given discounts or are giving discounts. I know one of the dollar store chains is giving discounts for healthcare workers. Several restaurants are doing the same thing.
Mhm.
Um, I am. It was very nice to see some of the local restaurants are actually catering food, and healthy food, I should mention, to the nursing staff and the hospital staff that work on the COVID unit. That was pretty significant. I have been really encouraged to see, and I feel like they would probably do this anyways, but the local churches have uh, been they've put all their services online, and they've been calling out to the healthcare workers, encouraging them, and I've really enjoyed that. A couple days ago, there was a drive-by of the local first responders, the police department and the fire department. They drove by the hospitals in the area, and they were, showing their support. That's
Mhm.
really encouraging. That was very encouraging, actually. Um, I think that different sectors of the community, at least the community where I am, I can't speak to other communities, but where I am, I've seen them reach out and help with what they can. So, like I
Mhm.
said, the the restaurants have been doing their part, giving out free food. The dollar stores, some other businesses are giving discounts. The first responders, I think that's really helpful. The other day I went jogging, and I saw there was a house where on the windows they had put signs thanking the first responders and the medical workers for their job, for what they were doing.
Yeah.
I know other stores have modified their schedules to provide a time where healthcare workers can go without having to interact with the other community, which sounds kind of cold, but they've been doing that. And so overall, I think what they've been doing is good, and I would encourage them to do so. It's hard to ask for support when we're not supposed to be communing, not supposed to be,
Yeah.
But in the ways that they can show it, I think they have been doing so. Online, through Facebook, through social media, through Windows.
Yeah.
So.
Yeah, I think that's one of the most beautiful things that we've been seeing, all of us, throughout this pandemic. It's just all the love and creativity that we all share, whether that's Michigan, California, or up in other countries like Italy. They were singing.
Yes. It's more difficult to do this, but I know that I was talking to my grandparents in Spain. They live in a fairly big city in Spain, and they were saying that at 8:00, all the people in residential homes, the homes there are much closer, and they have balconies, nearly all of them. So they all go to their balconies and they begin to clap and cheer for the healthcare workers. Wow. And I thought, what days? And I asked my grandparents, what days do they do that? And they said every day. So every day at 8:00 they do that. And like I said, I think that's what they can. They do what they can. Here it's a little more difficult. There are no houses are much more spread apart.
Yeah. But that's beautiful. That's a beautiful part that we're all seeing. That's great. Well, this is a little off topic. So Wild Faith sent out some care packages. Have you gotten yours yet?
Not yet.
Okay. I'll make sure we get our package to you and your friend very soon.
Okay. Yeah, not yet. I checked the mail this morning. I wasn't there yet.
Okay. I'll let you know and send you a tracking number or something.
Okay. Sounds good.
Is there anything that we can do, like in the community, as a community? What else can we do to help support medical providers?
Well, honestly, I think that the precautions that are in place as far as social distancing and not going where you shouldn't be going, I think that's it. I can testify firsthand that they work. And so this whole movement of stay home, stay safe, the at-home order from the different governors, they're there for a reason, and they do work. And so if I, as a healthcare worker, and not even one of the healthcare workers that are seeing patients directly, but I can testify that does help a lot. So I would ask everyone listening to please do that. It's always better to err on the more conservative side than on the other side, because it's just better to be safe than sorry.
Yeah.
So that would be the best. That would be the best. And I can't speak for big businesses or even small businesses, but I would ask that that businesses be considerate of the difficult moment that many families are going through. I think that this is a good time to not be greedy with money, because there are people that are very affected by this more than others.
Yeah.
So I would ask them to I would ask the community to set their greed apart and their selfishness apart, and do their part to help each other.
Mhm.
Yeah.
Thank you so much for that. It's very practical. It's free. All of us can do that.
Yes. Yeah,
Yep.
absolutely.
Well, how about your family? I know you have a lot of family. You said only you and your parents are here in the States. Most of your family relatives are in Spain or other European countries. How are they holding up? What are their experiences like?
Well, Europe is very interesting. Most of Europe, at least, definitely where my family is from, the houses, like I said, are much closer. Socializing is a lot more intense than it is here. No disrespect to the US, but people regularly pretty much on a daily basis go out and interact in the plazas and the different, open spaces in town. And so I would say that the precautions are even more strict than they are here. So I actually feel like it's a bit more difficult in where my family is at, and they've really struggled. Particularly my grandparents that I mentioned earlier. Very social people, both retired. Very social. They used to go on their daily, coffee run with their friends and go out on a walk through some of the streets. And now they can't do that anymore. And they're almost 80 years old. Their one daily activity was to socialize with friends, and now they can't do that. You take that away from them, and it's difficult.
Yeah.
Like I mentioned, they've been more strict in Europe overall, I think, than they have been here, and I feel as if people have, for the most part, done their part. But it's been a struggle.
Yeah. And FaceTime, Zoom, WhatsApp, video chat, all those apps can never replace the face-to-face and the coffee dates.
Yeah, no, absolutely. Especially for the older generation and the younger generation and the kids.
Yeah.
So it's a good time to be thankful for all of those, even though we can't replace face-to-face time with that.
Yeah. Is it true that children are allowed out on the streets now in Spain 1 hour a day? Yeah.
I think as of yesterday or today, something like that, very recent, and I think it's under certain. It's a protocol. It's not just that they're allowed out and about. They have to do certain things before, and it's only a certain time of day. Yeah, I'm not very well read on that, but
Yeah.
it's new. Imagine these kids have been only at home several weeks. It's terrible.
Yeah, I can't. Like you said, because most of them live in apartments too, or the houses are more, it's more populated. They live in a more populated city, so.
Having a house with a big backyard and a front yard and a 2-car garage and all that, it's not very common there.
Yeah.
A space to run around in the sun. It's not very common. So it's and keep in mind that they're not going to school yet. So
Well, thank you so much for sharing. And I know we talked about some of the very difficult questions. I'd say maybe even more difficult than the other questions in the other interviews. And I really appreciate you sharing the struggles and ways that communities, our communities, what we can do to help, and even a perspective in other countries. I don't want to keep you too long, Josue, because I know you have to go back to the COVID-19 unit in a couple of hours. But before I let you go, I just have one last question. During this time, do you have a favorite quote or a Bible verse that you're holding on to that's helping you go through your day-to-day life right now at COVID-19 unit, or to survive or maybe thrive during this time?
Sure. Yes, I heard a phrase some time ago that said, um, let every step be towards God, even if it is a step backward.
Mm.
And that is very inspirational, because I feel like as a society, this may be a step backward in a way. We didn't talk about the economy at all, and I don't know much about that either, but we feel like there's a step back, but I think we can use it to bring a lot of things out, and hopefully um, draw closer to God as individuals and as society. We really need
Yeah.
that. So that's what I try to live by.
Thank you so much.